I'm going to go ahead, and at this point, I may go ahead and ask him, because he says he's hurting, and I'll say, okay, let me go double check. And I'm going to come back down there and say, do you have any allergies to Demerol? You know, first of all, before I even attempt to draw it up. And then I'm going to come back, I'm going to look at my MAR and my physician's order, compare those. All right, that's my first check. I'm going to go to the Pyxis or wherever and get my Demerol out. Pull it out of the drawer. It's got my Demerol 50 per cc. All right. What I'm going to do is then compare it again with the order before I get it. Then what I'm going to do is I'm going to step back. I'm going to look at my Demerol again. Because chances are it's going to say meperidine. Meperidine sounds like Meprigan. Be very careful. Okay? Look at what you're given on this. If somebody's talking, say hush. You know, concentrate. Okay? So everything is good. So I'm going to open it. I'm going to clean. I'm going to draw my 1 mil up. I'm going to inject it into the vial. Inject. Pull back to 1 mil. Get all my air out. Look at it again. It says meperidine. Okay? Lay it down. And then I'm going to take this needle and put another needle on. Okay? Then I'm taking my MAR and I'm taking my meperidine down with me to make sure I don't have anything funky that I've overlooked again. Going down to the room. Okay, Mr. Smith. Again, identify them, ask them their name, date of birth. Always make sure you give it to the right patient. Remember your 7 rights. All right, then I want to say, okay, I've got your Demerol here. Do you have any allergies? Ask them a second time. Do you have any allergies to any medications? Or have you ever had a problem taking Demerol? Or you may say any of the opiates. You know, you can never ask too many questions. All right, then what you want to do is you're checking it. Okay, it's the right dose, right patient, everything. I'm going to clean. I'm going to give it in a style, let's say, for example. I'm going to clean. I'm going to press down on this one to press. Okay? I'm going to take it, give it, aspirate on this one. Make sure I have no blood. If I have blood, I'm pulling back and I'm starting over on a different medication. I'm going to give it, get my alcohol this way. I'm going to swoop and scoop. I'm going to go document, get him comfortable, yada, and go into the sharps. Okay? So, intradermal. All we're going to do on this is the physician has already put an order in for tuberculin skin testing. Okay, we're going to check it with the MAR and the order. I get my little PPD vial out, check it, okay. Yep, it's the right thing. I'm going to draw it up to a 0.1, inject the air into it, and then I'm going to pull back to 0.1. Checking, I have the vial right here, label side towards me, and I'm looking, because always when you're drawing up medicines, keep your label side towards you. Never losing sight of what you're given. Okay? So pull back. All right. Go ahead and swoop and scoop on it. I thought it was swoop and scoop each time. Then what I want to do is I'm going to the room. I'm going to ask him, Mr. Smith, do you have any allergies? Same questions. Identify the patient. Name, date of birth. And then I'm going to clean the site. Again, I'm going to hold taut on both. Okay? What I want to do is go bevel up, clean it, go in at usually a 5 to 15, 10 to 15 degree angle, and I'm going to insert and get my wheel. Using my alcohol pad, take it back out. And sometimes some of the facilities will want you to mark it where you gave it. So you might have to circle it, just depends, but check with your facility. Go back out, of course you wash your hands, patient comfortable, rails up, this kind of thing. Go back out, document where you gave it and how much you gave, always documenting how the patient tolerated. Whenever you give a PRN pain medication, you always go back and document within the hour or 2 hours. Follow your facility's protocol. Most of them say now within the hour. See how they're tolerating it. All right, any questions? Yes, ma'am.
Mine is, a lot of the facilities use the punch-out pills, where they put them on a card. How would you take the whole thing with you? before
Now
you
they don't
punch out?
use punch-out cards.
Since when?
Enterprise Nursing Home uses packets now.
Do they? That's cool.
Some of them have the
Punch-out.
punch out today.
Pain
Today.
medicines.
Huh?
Pain meds
Yeah,
still
yeah,
punch
pain
out.
meds are still
like the
punch
ones
outs.
having on.
What you're gonna have to do is, I would probably take a punch-out card to the room and say, this is what I'm giving you, without taking the whole thing in. You know, just say, I'm giving you lower tab. This is what it looks like. You know.
And the other one was the elevation, elevating the bed for the G2. We were always trained in CNA classes that you maintain the bed elevated all the time anyway. That you're not allowed to lower the bed with a G2.
We are taught here that, and remember, this is nursing, it's not
Yeah, I know, but I'm
CNA.
saying, you
Okay,
said
listen
to
to what
elevate
I'm
the bed, but
saying.
it's not supposed to not
Okay.
be unelevated.
The head of the bed will be elevated for at least, is it 30 minutes after tube feeding and 30 minutes after medications?
You can't go lower than 30 degrees is what I check off was for
Right.
that. And you're supposed to listen to the valve
Sounds.
sounds before you move them, and then you have to let them up
Right.
to a 90-degree angle. Because if it's below 90 degrees, it's an endangerment to your patient,
Right.
and you will get 50 points.
Right.
Ask
So-
me how I know.
So you're going up to a 90-degree angle when you're giving them.
You go up, is it 90 or 30? I have to look at the checkoff. 90, you go up 90.
Miss Bonnie told me, because I missed it last semester, just let the bed up till it won't go up no more.
Okay.
It's a half-hour position.
Yeah, half hours. You don't want to go to semi-hours. Let's see.
So you just let the bed up till it
Now see
won't
this place bed at 30 degrees.
go up.
That's what I said, I was reading it, it said 30, I was like, well.
It says place bed at 30 degrees. Right.